Hello students, welcome to Global Academy of Medical Education. I am Dr. Kabita and I am your faculty in microbiology. Let us discuss today the questions that were asked in microbiology in NEET PG 2023. I am sure all of you have performed very well, and let us discuss on the basis of the weightage of the questions. The maximum questions were from virology like previous years, and there were few questions, 4 from bacteriology, 1 from mycology, and 5 questions were from parasitology. So you know where to emphasize. So without further delay, the first question was on, since it is a recall based question, I do not have the exact question or the option, but this is a image based question where they have asked for the management of the particular infecting organism. Here we see that it is a gram stain smear, and the background is pink. All the neutrophils, they have been stained pink, and here in the intracellular region, we can see some diplococci, gram negative diplococci. So it is most likely etiology is Neisseria gonorrhoeae, which is gram negative diplococci, kidney shaped, and they have asked for the management. So management, we know we have to treat both the sexual partners, and it is third generation cephalosporins are most active against gonococci, and if it is combined with chlamydia third generation cephalosporin, most commonly ceftriaxone or cefixime. Ceftriaxone at a dose of 250 milligram IM in a single dose, and if it is associated with concomitant chlamydial infection, then we will add azithromycin, which is a macrolide antibiotic, 1 gram dose. Orally. We'll move on to the next question. Hemophilus, the question was showed an image of satellitism, which was and the most probable organism is Haemophilus influenzae. The causative organism, the history that was provided was of that of a child, most commonly of the age group of 2 months to 2 years, who presents with signs of meningitis, and the likely organisms which on culture they further showed that there was satellitism. Now what is satellitism? So we know that Haemophilus influenzae, it requires 2 factors. One is factor 10, which is known as hemin, and one is factor 5, which is known as nucleotide adenine dinucleotide. So this is the image of a blood agar. This is an image of a blood agar. We can identify by the color of the medium, and in blood agar we see that it is streaked with one colony of Staphylococcus aureus. So in order to clarify, I'll move on to the next slide. So we see that there is an inoculation of Staphylococcus aureus at the center, and perpendicular to which we will inoculate colonies of Haemophilus influenzae, and we will leave it overnight incubation. So what are the findings? The findings is the colonies which are closer to the streak of inoculation of Staphylococcus aureus, where we see abundant growth of Haemophilus influenzae, which gradually diminishes towards the periphery. The explanation to this is factor 5 is released from Staphylococcus aureus, which diffuses into the medium, and that aids in the growth of Haemophilus influenzae. This phenomena is known as satellitism. Now coming to the third question, was asked on, it was it presented with a clinical feature, it presented with a clinical syndrome of a sewer worker, and he had symptoms of hepatorenal hemorrhagic syndrome, and conjunctival suffusion, and they had asked for the diagnostic method. So diagnostic method, so we on basis of the clinical picture, we know about leptospirosis, which is also known as Weil's disease, it has 3 R's. It has got 3 R's. One is it is spread by rodent urine, so rodent urine, and also by in the rainy weather, and in the rural background. So in the this is the backdrop of the scenario, and since it presents with clinical features, of the following clinical features, we immediately point towards the diagnosis of Weil's disease. And Weil's disease, we perform a microscopic agglutination test. So what is a microscopic agglutination test? In this, it is the gold standard. It is the gold standard for the diagnosis. Gold standard for the diagnosis of leptospirosis. Although we do not perform it commonly, what we take is we take the patient's serum in a microtiter plate, and then we add the antiserum composed of the antigen from the locally endemic serovars. So then after that we will incubate it at 2 to for 2 to 4 hours. We will incubate at 30 degrees Celsius, and then we will take the suspension and observe under dark ground microscopy. So there we can clearly demonstrate the leptospira. Dark ground microscopy, we can see in the dark background the fluorescent organisms. They will have a coil structure with a curved ending. So this is the microscopic agglutination test used for the diagnosis of leptospirosis. Coming to the next question, which was on the diagnosis of rotavirus. We know rotavirus is the most common cause of diarrheal illness. Most common cause of diarrheal illness in the infant. Most common cause of diarrheal illness in the infant, followed after. Then the next common cause is adenovirus. So what is the specimen of choice? Specimen we use is stool specimen. So stool specimen we can process by 2 methods. One is by both we detect the antigen detection, but in antigen detection we can perform a immune electron microscopy, or we can perform ELISA. As far as I know, as far as I've heard about the question, they had not provided the option of immunoelectron microscopy. So we will move to the next most likely diagnosis, likely modality of diagnosis will be antigen detection in the stool by ELISA. So this is the answer. Next question, it was shown, this was the image shown in a child. It presented with whitish to bluish spots in the buccal mucosa. So this is a very to the point question, and it is very suggestive that it is measles, and the spots are the Koplik spots. So this was a question. This image has been taken from a journal, very popular journal, New England Journal of Medicine, where they have shown this image, and the likely condition was that it was associated with HIV, and perhaps they were asking the most common malignancy associated with HIV along with this image. And this is, we see a purely vascular tumor, and here we can, I don't know the options, but if it had been a case of the most common malignancies associated with HIV are, one is lymphoma, and another is both CNS and Hodgkin's, and then we have Kaposi's sarcoma, which is caused by human herpes virus 8. And this is the human herpes virus 8, and this is the most likely diagnosis. So we move on to the next question. So this is again a question on HIV. So there were a lot of questions on HIV. Here we see that the patient presented with multiple pink or pearly white papules, and this is probably and you see in the center there is some umbilications. So this is most likely a case of molluscum contagiosum. molluscum contagiosum. Exact question I am unaware, but this had been the image, then it is a case of molluscum contagiosum. We move on to the next question, which was a patient presented with a painless genital ulcer and painless inguinal lymphadenopathy. So, whatever has been the history, if we divide the genital ulcers, we know that in syphilis, it is the ulcers are both painless and single painless ulcer, and the inguinal lymphadenopathy is bilateral, which is also painless. So in syphilis, from that you can remember that everything is less. So we come to the broad classification of genital ulcers. So we have most common causes as syphilis, genital herpes, chancroid. So syphilis is also known as hard chancre. Syphilis is also known as hard chancre, and we have genital herpes, we have chancroid caused by Haemophilus ducreyi, and we have lymphogranuloma venereum caused by Chlamydia trachomatis serovirus, and donovanosis caused by Klebsiella granulomatis. In this, since they have asked for painless genital ulcer, so painless, there are two causes. One is syphilis, and which is single indurated, which is hard, and also in lymphogranuloma venereum, it is painless firm single lesion. But lymphadenopathy in case of syphilis will be again painless non-indurated firm lymphadenopathy, and lymphogranuloma it will be painful and soft. So, and all the other causes, genital herpes, they have multiple tiny bilateral vesicular lesions. In chancroid we have again painful lesions, and in donovanosis it is painless, but it is like once we rule out the causes of first we will keep in mind the diagnosis of syphilis and lymphogranuloma venereum, and if the patient does not respond after 4 weeks, we will suspect that it is maybe we may culture it for Leishmania, we may culture it for Klebsiella granulomatis, which causes donovanosis. So this is the diagnosis of genital ulcer. Next, we had a question on periventricular calcification, which was causing encephalitis in a child. Encephalitis in a child. So they had not provided this image. They had provided this image which showed periventricular calcification, and the virus responsible is, here it is herpes simplex virus. We have both 1 and 2 which causes herpes simplex, which causes encephalitis, and it also causes meningitis known as Mollaret's meningitis. And in histopathology we have this characteristic appearance. This is known as owl's eye appearance. Next, we come to herpes simplex virus encephalitis. They had asked for the diagnosis. So diagnosis will be by the detection of the herpes simplex virus DNA by PCR. It will help us in differentiation between herpes simplex virus 1 and 2, and it also will help us in quantification of the viral load. Next, this is a picture which unfortunately it is very unclear, but then in the history had suggestive of again a HIV patient, which again a HIV patient where they presented with pneumonia, and the diagnosis here is that they had performed a Gomori methenamine silver stain, and although we cannot see it here entirely, it is dark, but then it has a green background, and here we see the crushed ping pong ball appearance. So this is in the green background which we see crushed ping pong ball appearance of the cells. So it is a case of Pneumocystis jirovecii. Next, this was a question asked which was Trichomonas vaginalis, seen in a female with the history of discharge. And then in Trichomonas, what was the motility? So they have provided four options, of which there were two. The diagnosis was based on the motility, which is the twitching form, twitching or quivering motility, and quivering motility, and also twitching and quivering motility, and also there is only one form of trichomonas, which is the trophozoite form. So if they had mentioned about the cystic form, then it was probably a wrong answer, and the answer will be trophozoite form seen in wet mount with twitching or quivering motility. Then we come to filariasis. They had asked for the diagnostic modality. So, but we know that there is a popular test known as DEC test or DEC provocation test, diethyl carbamazepine test. So we know that the microfilaria, they appear in the blood only mostly in the night. Hence, if the peripheral blood smear is taken during the morning hours, we may miss out on the diagnosis. So in order to avoid the situation, we will perform a diethyl carbamazepine test where we will expose trigger the release of the microfilaria, that will be seen, that we can see 15 to 1 hour after the 15 minutes to 1 hour after the introduction of the after the administration of the drug. So most probably they had asked for the diethyl carbamazepine test used for the diagnosis of microfilaria or Bucheria bancrofti. So next they had provided a HRP test and asked for the species where we detect the species of malaria which we detect by histidine rich protein 2, and we know that in rapid kits or immunochromatographic kits that are used readily for the diagnosis of malaria, Plasmodium species, Plasmodium falciparum, they give a Plasmodium falciparum, they give a they in the immunochromatographic test they are reactive to this HRP2 antigen. So this was perhaps the answer of the question. Next we come to the answer is provided, but probably they had given such an image, this like this they had provided an image in which we see they have clearly mentioned about the kinetoplast and the axoneme. This is the amastigote form. The history provided was a patient with ulcer probably from Rajasthan, and it was a case of it was a case of oriental sore. It was a case of oriental sore presenting as an ulcer, also known as Delhi boil or Baghdad boil. And here in the macrophage they say that there was kinetoplast and axoneme. So this was a case, this was a typical case of Leishmania tropica, which causes the bodies are known as LD bodies, Leishmania Donovan bodies, and since these are found, they are known, the most causative organism was Leishmania tropica. Here the last question we had was the malignancy associated with which of the parasite we know, and the answer was Clonorchis sinensis is associated with cholangioadenocarcinoma. Cholangioadenocarcinoma, and it was another option was about schistosoma. So we know that schistosoma hematobium, it causes bladder carcinoma. So if they had asked for the parasite associated with cholangioadenocarcinoma, the answer would have been, the answer is Clonorchis sinensis. So this was some of the questions that were discussed in that I discussed regarding the NEET PG questions that were asked in NEET PG 2023. With more questions, we will discuss further the rest of the questions.